Okay, hi guys, this is Amy. Welcome back again to Health Focus. This is a place where you have to be if you want to get and consume any content in relation to health. We talk about various things, and today I just want to highlight a few things that icks me when I speak to somebody who has gone to seek medical care, anybody who is seeking for advice concerning medical care. This thing gets in my nerve. And that's why I want to educate all of us. And kama kawaida, when you see me alone, just know that it is learning session. As I was saying, it's about patient rights. So tomorrow when we meet and you tell me, oh, my dad, oh, my mom, oh, my sister, oh, my mother, this is the issue, please get all the things that you need to know as the patient or as the relative. I'm addressing patient rights in Kenya or anywhere in the world. You as a patient, what's your right? Let's begin with the first one. The first right is you have the right to access the highest standard of healthcare. You don't need to get seen by a person who is not specialized or qualified for that condition. Let me give an example. You have a renal condition. Why are you not being seen by the nephrologist? I mean, why? I want to understand, yes, there is a financial aspect, but why are you not pushing yourself to be seen by the surgeon and you have a surgical case? I understand the referral system. I want to understand everything. But again, you have the right. It is your right. It's not me as a provider to decide for you. Understood? That is the first thing. You have the right to access the highest standard of healthcare that you require. If you need oncology, see an oncologist. If you need, I know the statistics in the world. There is a video I did about the number of cardiologists we have in Kenya. Yes, there are 11. Yes, I know the ophthalmologists of squint specialists, there are 9 in Kenya. I agree, but you can get their service. Let's move to the next point. You have a right to choose any hospital. It is your right. Nobody is going to tell you, go to this hospital or go to government, go to private. It is your right. Nobody should coerce you. Nobody should push you. Nobody should determine where you want to seek healthcare. You have that right to choose. And if you don't want this particular hospital, you have a right to change it. So be aware that it is within your right to say, I am going to do this surgery in this hospital and know the doctor's power. It's not the doctor's power. It is not the nurse's power. It's not even your mother's power. It's within your power as the patient to determine the hospital that you want to be seen from. You have a right to emergency care anytime, anywhere. You are sick today, you've gotten an emergency to be attended to. The nearest hospital is one of the tertiary hospitals in Nairobi. It is your right to be given emergency care. This one is even in the Constitution. It is within your right to receive that emergency care before you are referred out to your hospital of choice. So stop having this issue like, now I can't go to this hospital because I don't have money or something. It is your right. Emergency care is emergency care. You can be attended to in any hospital. Let's proceed. You have a right to your medical information. This is where I feel like carrying every patient and putting something in their head that you have a right to your information. You have a right to know what are you suffering from. You have a right to know what is the prognosis. Prognosis is what's the outcome. You have a right to know what drugs, what is the side effect of this drug, what care do I need, what extra attention do I require. You have a right to your medical information. Even further, we have hospitals that have gone electronic that you can log into your portal and access your patient record. Again, in developed countries, I understand you can access your medical record. It is yours. That record is yours. I know as health providers, we are keeping those files like they're ours. It is for confidentiality and security that nobody else should access it. But you as a patient, you have a right to your information. So next time we meet, stop telling me oh, the doctor didn't tell me what I'm sick. Oh, I don't know the drug I'm taking. Please, it is your right to get access to your medical information. The next right, a right to informed consent. This is where, I don't know whether it's the community or the institutions that have put this in place. Like you come to a hospital, we just give you treatment. You need to give a consent that I have come. And further notice, some hospitals you sign that I have come to get treated. You give a right to be treated. And again, if you don't want to be treated and that condition is an emergency and we don't need to refer you, you sign against that you do not want to be seen. We call it living against medical advice. For all patients who come to the hospital and they have said, no, let me go home, you've seen you are given a letter, a paper to sign that I don't want to be seen. And especially if it's an emergency, it's living against medical advice at your own risk. But you must give informed consent to be treated. Okay. In circumstances that you are unable to give an informed consent, they are highlighted where you can receive treatment. That is number one. When it's an emergency, we will not wait for your informed consent. It's enshrined in our laws. When there is a court order for us to treat you, we will not require your consent. When your lack of treatment will have a public health issue, for example, we have communicable diseases like Ebola, like COVID, we will treat you whether you like it or not. We will not wait for your consent. And finally, if delay in treating you will cause to so many complications, we will treat you. Those are the only times we can treat you without an informed consent. But either way, you must give the consent. You have a right to refuse treatment. Yeah, imagine you do. At your own risk, you will say, I don't want surgery. Nobody will force you. We will release you home, again, against medical advice. You can refuse treatment. You can go. You can choose you don't want to do chemotherapy or something. It is your right. Nobody should force you. You have a right to seek second opinion. So many people, especially in the rural areas where Daktari amesema, can you seek for second opinion, please? Whether it is from a herbalist, seek for a second opinion when your heart feels that you need to get a second opinion. The next right is the right to confidentiality. I mean, we live in an era that everybody wants to know what is the condition, what is the problem. Everybody in the entire family, like from your grandparents to your mother, everybody wants to be privy of the information of your health status. You have a right to confidentiality, and this is the time when you sign the right to be treated. You will even say who do you want your health record to be given to. Not everybody. When you come to the hospital to seek for a medical report, especially if it's not you, it is there is somebody we call a next of kin. When you go to hospital, please, when you go to seek for medical services, who do you write as a next of kin? We've seen issues whereby the next of kin is a friend, or the next of kin is a workmate, or the next of kin is a neighbor. In times of giving information in healthcare, we will not give this information to anybody unless it is that next of kin. So kindly, when you write who is the next of kin in your record of hospital, write the next of kin. Don't write anybody who accompanied you to hospital. The right to insurance coverage without discrimination. Like you have a right to be, it doesn't matter what you're suffering from, you need not to be discriminated. It's your right to get insurance coverage. And then you have a right to complain. So when you go to a hospital, you've always seen suggestion boxes for complaints. And if that hospital doesn't have that, can you advise them to do that? Because it is your right to complain when you're not satisfied, to even complain legally, to even shout and scream. It is your right. Let nobody intimidate you and let nobody make you feel less. It is your right to complain. Stop saying, if I complain, they will stop treating my parents well. Let me tell you, as a provider who has worked in the ward setup, in the hospital setup, there is no patient we will cease to treat because you complained. In fact, you become a special patient that, we have to do things right to this patient. Unless your complaint is, you see that complaint that you love complaining about things that are not important. You're complaining about a towel, you're complaining about a curtain, you're complaining about a uniform. We don't take those complaints seriously, even though we do. But if it's a medical complaint, my friend, you have a right. It doesn't mean like you don't complain about curtains. If that is where you feel we need to, that's not a complaint. I think it's an area of improvement. Then we have the right to donate an organ when you feel like. I will not emphasize on this. And then finally, the right to be informed of all provisions of your health insurance policy. When you've gone to get an insurance policy, let your agent, let your provider tell you everything that is covered. Not in that fine print they keep on telling you. It is your right to know all these things. So, in a summary, those are the patient rights that encompasses your patient care. So tomorrow when you go to seek care, please don't come and tell me you don't know what your diagnosis is. You don't know what you're being treated from. You don't know the drugs you're taking there for what. You don't know who your next of kin is in a hospital. In a nutshell, those are your patient rights. See you next time when we meet. Bye-bye.